I would say after a pregnancy loss, it's really important to follow the woman's lead and to maybe mirror the language that she's using. So for me, each of my pregnancies did represent a life, and even to this day, they're still my babies that I lost, and I still think about them and I still love them just as much as I love my daughter. But I do know that for other women, maybe particularly women who haven't experienced repeat miscarriages, they probably don't have that same emotional attachment. It is important, though, to actually refer to the pregnancy. It's an important part of people's medical history as well as their emotional and mental health state of mind. So it shouldn't be not talked about in case it makes people feel uncomfortable or awkward.
Yeah, I think it's really important to acknowledge the loss. So if I see someone after a miscarriage, whether or not they're coming in because of the miscarriage or about something else, I always say, I'm really sorry to see what's happened to you recently. That then gives a woman the opportunity to say, oh, it's fine, I'm okay, or to then, start to talk about it. And I think mirroring language is really, really important. And I think you have to be led by the lady as to whether they talk about it as a pregnancy, as a baby, or possibly as a fetus. I wouldn't ever use the word fetus without the lady using that term first. If you know that they're coming about their pregnancy or they start to talk about their pregnancy, then obviously you might refer directly. I'm sorry that you've had a miscarriage. I'm sorry to see you've been in hospital recently, especially a few weeks after, because I think, as I say, for some, it's still very raw a few weeks later, and actually for others, they might be coming in to tell you about their next pregnancy, and they don't really want to discuss their miscarriage.
Expressions such as chemical pregnancies, I find quite difficult to hear. I feel like it's minimising the pregnancy by sticking the word chemical in front of it. And when I had my miscarriage, and then there was discussion around the evacuation of retained products of conception, the amount of distress that phrase caused me, and even to this day, trying to talk about it now, I can feel myself feeling quite upset again, because to me that was a much longed for, much waited for baby